Just weeks after Governor Wolf declared a state emergency on the opioid epidemic, the city of Philadelphia announced plans to encourage the opening of safe injection sites where people can inject drugs off the streets under medical supervision.
We are facing an epidemic of historic proportions. The people of the city of Philadelphia, our brothers, our sisters, our parents, our children are dying, and they don't need to die.
Mayor Jim Kenney commented on the announcement at a separate event.
My issue is more of a compassion and trying to make sure that people don't inject themselves and fall out on the street and die.
A safe injection site has never been opened in the United States. Now, Philadelphia, where frontline workers responded to as many as 10,000 overdose incidents in 2016, could become the first city to host one. Underneath the L on East Lehigh and Kensington Avenues, across the street from an elementary school, playground, and church, a tent city has sprouted. No longer spreading out on the tracks in the Gurney Street train gulch or taking up residence in front of McPherson Square Library, people suffering from addiction have been chased out of areas they once occupied and are now forced to settle on sidewalks underneath bridges, sleeping in tents and getting high in broad daylight. Families from the community and people coming from all over the country with opioid addictions converge here in Philadelphia's Kensington neighborhood. Kensington has long been the epicenter of the city's heroin trade. Philadelphia, considered the East Coast's largest heroin market by the U.S. Drug Enforcement Administration, holds the fourth highest rate of overdose deaths among all U.S. cities and the highest among big cities. An estimated 50,000 Philadelphians are misusing prescription opioids. In 2016 alone, there were more than 900 deaths. The death toll for 2017 is expected to climb to 1,200. Advocates argue that safe injection sites have inherent public health benefits and act as a bridge to addiction services and eventually treatment. The sites are highly controversial, with opponents fearing they will draw drug users and enable addiction. Without these facilities, police, EMS, concerned strangers, and other addicted people are charged with bringing overdose victims back from the brink.